Let's try this again. Thanks for sticking around. So,
Take a deep breath, all of you.
I need my connected blood pressure cuff right now. Okay. So, we're going to talk about the future of health and medicine. And if the clicker works, which is not, you all know that Startup Nation has a lot going on. This needs to be connected directly to my laptop. Thanks. Lots of happening there. I've been there many times as a medical student, spent time at Tel Shomer, been to many events there. I just keynoted the Med in Israel conference. This needs to connect it directly because I click fast. Okay, please. So technologies are moving quickly. How do we use those to rethink health and medicine across the spectrum, from health and prevention, keeping yourself healthy, having a long, not just lifespan, but health span? How do we pick up and diagnose disease early rather than late? How do we think about therapies that are more personalized? How we democratize healthcare, and how can we even speed up the pace and change of discovery, clinical trials, and beyond? So lots is happening there. But sick care is really our model today. We still practice healthcare like we have for hundreds of years in old silos and old ways of thinking, defining disease by body parts rather than at the molecular level. And we're now in this connected, digital, exponential age. We can rethink and reimagine healthcare, and that's starting to happen with this convergence of technologies. So I mentioned this idea of sick care. What do I mean by that? Well, we're entering an era today where we still have challenges getting our data back and forth between ourselves, our clinicians. We're still faxing or PDFing information. We're still quite reactive. We then wait for the heart attack or a stroke or a cancer to be developed or to be detected at stage 3 or stage 4. And I think the blend of all these new technologies, many of which are already here, is that we can be much more continuous with our information and then hopefully much more proactive, picking up disease early rather than late, or managing diseases in smarter, more continuous ways. So the model today, however, is still wait over an hour for that average 12-minute clinic visit, whether you're in San Francisco, Tel Aviv, or Calcutta. We have the opportunity to use technologies, but we need to blend the new technologies with the new incentives, because the way that healthcare or sick care happens today, especially in the US, is we're spending 80% of our healthcare dollar on the folks who already have advanced chronic disease. We're starting to change the incentives to keeping people healthy, this idea of value-based care, where outcomes are the new incomes. We're going to pay for new drugs, devices, and apps when they work, not just when they're prescribed. So part of this new era is, where can healthcare happen? No longer just in the four walls of the pharmacy. Someone follow along my clicks, please. We need to move healthcare from the hospital to the home, to our phone, to into and outside our bodies. And that's sort of where technology is taking us, even to our corner pharmacies, which are becoming healthcare centers. Now, along with the new technologies are the new empowerments. Each of us as individuals, as consumers, can compare one hospital to another. There's the Yelps for doctors, like Vitals.com. So you can compare prices from one pharmacy to another. We have a whole new set of tools to enable us to do that. Of course, our smartphones, we've only had iPhones since 2007. It's only been 10 years, are moving very quickly and are becoming healthcare devices. And Samsung came out with a new phone yesterday. Apple's rumored to come out with a new one soon, but I have a sneak peek. Here's the look at the iPhone 10 and the iPhone 11, all of which, of course, are becoming healthcare platforms, and they're riding Moore's law, the power of computing getting faster and cheaper. So part of the theme of the future of medicine is exponential. Think about where technology is today, but where we'll be with AI, robotics, 3D printing, and how these things are coming together. Because just like the desktop of 2000 now fits on your smart watch, now basically that whole smartwatch computing fits on a computer the size of a grain of rice, which is also becoming connected. This Internet of Things is being applied to the Internet of Medical Things. We're in the 4G world. We'll soon be in the world of 5G in a couple of years. It's 100 times faster in terms of the information that can come from your mobile devices. So lots of potential to rethink healthcare. And some of that's summarized by the term digital health or mobile health or connected health. I think those are all buzzwords. We'll just soon call it health. But the ability now to connect the dots between our own information and genomics and data sets and AI does give us this opportunity to rethink things. And we're starting to study whether some of these sort of apps and widgets and wearables are starting to work. So when you're thinking exponentially, don't think about just Moore's law. What's converging from 3D printing to AI to sensors? And how do we use that convergence to address big challenges, from rising costs, aging populations, access to care, no matter what happens to Obamacare or Trump care or Putin care, or whatever we end up calling it. It's okay, comrades. We have a lot of shortage of doctors and nurses in many parts of the world. We have lots of big data coming at us, but how do we make that big data actionable information that you can use as an individual consumer? And how do we help our friends, the regulators, the FDA, and the insurance companies reward and bring some of these new technologies to market? So we're here, of course, in the home of Uber, or no, that's not such a hot name. We're in the home of Lyft. Everyone wants the Lyft of everything. Even Uber did a pilot health where you press a button in the app and a nurse would come to you. They're also helping bring folks to hospitals and clinics. We're seeing Ubers for doctor care, where you press a button on the app and a doctor comes to you. Not sure what kind of doctor you get, but you get a doctor just by pressing the button. So that era of on-demand healthcare is coming. We're seeing that come and disrupt all sorts of fields being disrupted. It's starting to come to health and medicine, to pharma, when we're not in the one-size-fits-all drug world anymore. It's coming to the world of the payers, companies like Oscar Health that are starting to change the insurance landscape. So you all want to Uber yourself before you become the next Kodak. Kodak had their Kodak moment. They weren't paying attention to the power of digital photography, and they got their lunch eaten. So I get to have a purview on this, chairing the medicine track at Singularity University, which is just down the road. Our goal is to bring leaders together to understand the pace of technologies, how to pull them together. A lot of Israeli alumni, there's some of us in Tel Aviv a year or two ago. We look at how do you think about exponential technologies to solve challenges from poverty, education, and healthcare. And about half of the new companies that have emerged out of Singularity U have been focused on health and medicine. And because health and medicine is such a team sport, which is now cross-disciplinary, 6 years ago I started a program, which Yossi has been to, called Exponential Medicine. We started with a blend of physicians and technologists. We've now grown to about 600 folks at the Hotel Del Coronado in San Diego every fall. And it's a pretty magical 4 days where we look at the cutting edge. How do you, with 60 startups, faculty ranging from Vinod Khosla to Craig Venter, everyone gets to wear scrubs. We can even, of course, now with a $100 drone, take a picture of our group by drone. Next slide. There we go. So exponentialmedicine.com has a lot of the prior talks and information for next year's program, so please join us. Okay, let's look at a few areas.
What is the date?
November 6th through 9th at the Hotel Del Coronado, the most beautiful hotel on the West Coast. So let's look at a few examples in health and prevention that are moving quickly. We know this slide doesn't seem to look well, but behaviors are more important than our genetics in terms of our health and medicine. And we're now in an era where we can start to understand our behaviors and how they drive chronic costs and chronic conditions. And we can now start to measure them. We're, of course, in the era of the Fitbit. I'm wearing one, I'm wearing three. You guys may have one or two on. And these kind of devices are enabling us as consumers to own our data, to be more empowered, to be maybe not the CEO of our health, but the COO of our health. And we can measure almost anything today. Just a few examples of what's coming. We're moving from the era of quantified self, the data lives on your wrist or your phone, to quantified health. The data is going to flow to your doctor, to your healthcare system. The NHS in England is starting to pay for and prescribe wearable devices and glucometers and step counters. We're seeing the sensors evolve from simple accelerometers to sensors that live inside of pills and tell when you took your medications or not. Blood pressure cuffs can come now that squeeze your wrist to measure blood pressure. Glucometers can talk to your smartwatch and help diabetics. Or these glucometers can now be embedded in watches as they're going through FDA trials. There are digital tattoos that are disposable that can measure blood sugar or other information. We're going from wearables on our feet all the way to insidables. Google down the street, or Verily Health, is now developing contact lenses that can, with Big Pharma and Novartis, to bring glucometer detection into your contact lens. And now you can put chips underneath your skin that can store data, but we're soon going to have this idea of insidables, sensors underneath our skin that track our physiology, can transmit that 24/7 and help you and your healthcare team keep you healthy, or it obviously starts with the military world, but help manage prevention, diagnostics, and therapy. Other cool examples, trainables. I showed you the example of the back sensor, the idea that now we can have a wearable device that helps us with our posture and can manage things like lower back pain, something that might be easily treated with a wearable for folks who have bad posture when your Jewish mother isn't there to nudge you. Shockables, Pavlov was on something that keep people changing. Hearables, my new hearing devices don't just play me music, but they can track my steps and my heart rate. Ringables, I showed you the ring I'm wearing that tracks sleep. Sleep is something so critical to all sorts of elements of health and medicine. You can have a sleep lab on your finger. Breathables, breath is a biomarker. There's a local company called Breathometer that's making a sensor that can track the quality of your breath, important if you're going on a date, but also might pick up molecules that are related to lung cancer or other diseases. So breath is a biomarker. Sweatables, if you're running a triathlon or if you have heart disease or renal failure. Sockables for diabetics again. These are just a few examples that are out there. This is an Israeli company making a sensor for Parkinson's patients to help manage their medications based on their tremor. Poopables, you get that one. Protectables, I met this company in Israel. It's basically an airbag for folks at risk for falls. That's kind of different kind of wearable that can maybe prevent a hip fracture. A lot of technology built into your belt. Now, none of us want to wear 12 different devices or have 15 apps on our phone. We need to see these become integrated. And the fact that the Apples and the Samsungs and the Facebooks of the world are building health into our consumer technologies is really, really powerful, because that can then change your behaviors and give you incentives. You get lower insurance premiums if you're walking 15,000 steps a day, or by the way, whole new business elements are optional here as the incentives change. You can't just put your Fitbit on your dog, but people will try that. If you have heart failure or heart disease, these sensors will be embedded in our clothes and give you early warning. So the idea here is now we can censor almost anything. There's Bloom Life down the street censoring pregnant women in the last trimester. There's an Israeli company doing something similar. So we can lower risks for high-risk pregnancies and have better outcomes at lower costs. And when that little baby's born, well, you can do fun things like censor their diaper. That used to be from Wired Magazine, an artifact from the future, but now we have, for real, things like Tweet Pee from Huggies, or another Israeli company doing something similar to go into your loved one's diaper and give you a little message. So lots of ways we can integrate technology today and information. The trick is, when is it too much? Just because you can censor your kids and your teddy bear and their onesie and their milk and their, that's a lot of data. What are you as a parent, a pediatrician, a pharma company going to do with that? When is it going too far? Other things we might want to censor that are important are, of course, mental health. Mental health crosses all sorts of disease spectrums. We've gotten better with treating cancer and infectious disease, but suicide rates are up. We can now use our voice. I think this Israeli company is here, beyond verbal. You can use voice as a biomarker to understand people's emotion states and record that. Here's Tom Brady, the quarterback, making excuses, but the software can understand his emotions. Self-pity, poor Tom, right? You can download their app called Moody's and see if your spouse, boyfriend, or boss are really angry or happy with you. So that plays into mental health. They've even partnered with Mayo Clinic to show that voice can be a biomarker for heart disease. So lots of things we can start to quantify and measure as we go, and these can be applied to managing depression and schizophrenia and beyond. So where are we heading with this? Our homes, just the Wi-Fi alone can start to pick up vital signs. We're not going to be wearing anything, but our digital exhaust is going to be sort of streaming off us 24/7. That's a lot of data. How do we make sense of it? It's a bit of a so what, unless your doctor can see it, it flows to your healthcare system, you can extract the actionable information. And it has to be part of the workflow of your poor, overworked physician who spends twice as much time typing medical records than actually FaceTime with the patient. So technology needs to get out of the way. That's starting to happen. If you have HealthKit on your phone and you go to Stanford, you can now plug in your data into your medical record at Stanford. So my physician at Stanford can see my information flowing through my smartphone. Now, he doesn't want to log into my data every day. He wants to see trend lines. He wants to see my check engine light. Just like your modern car has 300 sensors, we're soon going to have our own equivalents of check engine lights for the body that integrate the data. And it won't be the devices that are the money makers. It's going to be the software layers on top that can integrate and make sense of this. And just last month, a Stanford professor, the headline was Check Engine Light for Health. He picked up from his wearables that he had Lyme disease before he knew it. So again, proactive early warning. And lessons from Tesla. We can download software to our Teslas to make them smarter. They share information. Then the next upload informs other Teslas around them. What if our own health data informed other patients around the world and kept improving the maps for healthcare? Now, we know just because we have data, that doesn't make us smarter. We need sometimes coaching. Behavior change is hard. If Yossi wants to lower his BMI further, he might need a digital coach. You can go to companies now like Vita and get a real digital coach, a real coach that watches your data. Or increasingly, there are AI coaches like the Lark app, which is sort of a smart chatbot for managing your behaviors or tracking your sleep and giving you guidance. We're seeing these come to, our Amazon Echoes are becoming healthcare platforms, not to just order music or an Uber, but to help you with your medication regimen or your diabetes or calling for help if you've fallen down. We're going to have digital mirrors that give us coaching. We'll look in the mirror in the morning. It might tell us how we're doing. It might show us you of today, but it might also show you of tomorrow. You of tomorrow, here we go, if you're working out, if you're really doing your workout, if you're really, really working out.
I need such a mirror.
Yeah. Or if you keep having, sufganiyot or donuts for breakfast, you of tomorrow. Last one. Come on, guys. There we go. One more. This is if you're eating donuts every day, right? And I can simulate that now. Here's me today, and here's me 100 donuts later. Or if I'm managing a patient who smokes, I can show what her face is going to look like before smoking, after smoking. Hard to see on this one here, but that kind of changes physiology. And that's blending technologies like, too much time on Facebook. It's not good either. Blending things like augmented reality. Google Glass was not a big hit in the consumer world, but has lots of applications in the clinic, from physicians seeing the data or others scribing through these devices. We're seeing HoloLens come out now to teach medical students anatomy. So very powerful ways to train and do education. It's amazing ways now to do simulation or to practice a procedure before you go into the operating room, or even when you're in the operating room. This is an Israeli company called Augmetics. They've developed basically augmented reality goggles. So you're looking at your patient, and you overlay in their CT scan data or MRI data, and you can be a much faster, more effective job. So this is, I think, where a lot of interventions are going to occur, again, blending this sort of information. And this can be, like companies like Meta that you met yesterday, can be used for medical education or maybe by anesthesiologists, or we're going to see these things come into medical education. This is an app called Virtuality. You basically can play with this t-shirt and literally see through the t-shirt your anatomy. It's great for kids to learn. So my son, Leo, who's now almost 3, knows his own anatomy by wearing his little augmented reality shirt. Kind of that's an educational platform. We can see virtual reality, not just for fun and games, but low-cost versions that can be used now as therapy, VR, to treat patients, let's say, who have burn injuries. They go inside a cold environment, and now they're throwing snowballs, and they use less than half of the amount of opiates. So nice, smart ways to maybe do smarter therapy through VR. Physical therapy, time in the hospital, all can be made more engaging. And of course, these sorts of tools now are being used to record surgeries and share that information and change the way we do medical education. I was in London for the first VR live stream surgery. 3,000 people were watching the surgery in live time as that went on. They've been able to do this with Snapchat goggles. So my friend Shafi Ahmad recorded the first surgery wearing these sorts of goggles. So lots of consumer ways these are coming together, including how we'll exercise, things like Pokemon Go, get people off their feet and moving. All right, I'm out of time, so I'm going to just do 2 minutes more on a couple elements. Genetics are getting super interesting. We're now in the era of what used to be $1 million genome is down to about a $1,000 genome, soon to be a $100 genome. How do we take that data and make it useful? Even with 23andMe, I can take that data and look at my risk for heart disease or diabetes or how I'll respond to different drugs. What if your doctor had that data and could use that to tune your therapy? We're starting to crowdsource thousands of genomes and learn that in diabetes there are at least 3 different distinct subtypes which might respond differently to drugs and therapy. So we'll define things at the molecular level. We're in the era of proteomes, microbiome. You can get your own microbiome sequence today, companies like Ubiome, and look at the bugs in your gut and how they impact disease. We're seeing that microbiomes impact obesity, maybe Parkinson's disease, Alzheimer's. There's even an Israeli company looking at your microbiome and suggesting what diet to be on. So lots of ways these are going to come together. And of course, we don't need fancy technologies. We can do old school things to stay healthy. We can learn how these measure and impact our brains today with brain-computer interfaces, like the interaction on Muse, where you can use this to prescribe someone meditation or mindfulness, or to treat kids who have attention deficit disorder to learn to focus. So that's disruptive to folks who are making drugs for ADHD. Several Israeli companies are doing technologies in this space. We have advanced brain-computer interfaces that are in clinical trials for severely quadriplegics. But as you may have heard the other day, this is coming now to maybe the consumer. Elon Musk is going to be launching a company called Neuralink to do advanced brain-computer interfaces. So watch that space. Last couple pieces. Diagnostics. We want to make diagnostics easier, not just in the clinic and the hospital. We now have a digital doctor's bag, all these sorts of tools that you can bring to anywhere to do an ear exam and send that information to your pediatrician right through the smartphone. Another Israeli company called TytoCare is bringing all these technologies and integrating them into one. We're seeing ways to do dermatology. You can send a picture to a dermatologist and they can make the diagnosis. Or soon the AI, the machine learning, is going to replace the dermatologist in some settings. Just like the eye exam is going from this version to a version that can fit on your smartphone. And now we're seeing ways to look at the back of the eye, and companies down the street like Google are applying machine learning to look at the retina or to do pathology or radiology. So we're going to start disrupting the world of radiology, pathology. This company called Zebra Medical, which I just mentioned, as I mentioned, is doing some incredible work and now working with Intermountain here in the US to put that into the system. So we have lots of ways to do diagnostics, all the way down to EKGs that you can fit on your smartwatch or on your smartphone to pick up funny rhythms. We're seeing ways to now measure that information and even replace the old-fashioned angiogram or to wear a patch that replaces an entire intensive care unit. And if you do think you have heart disease, you can now send that data up to the cloud, do a 30-second CT scan, and computationally measure your blood vessels. Do you need a bypass or a stent? How narrow is that vessel? If you need a stent, maybe that stent can be 3D printed and designed just for you. So lots of things happening in the diagnostic space. This is just an example of something coming to market already that will be changing how we do heart disease management. I've been involved in the medical tricorder. That's a new prize that's 4 or 5 years old to make a diagnostic that fits in your pocket. About 400 teams entered this competition. We're in the final stages. The winners will be announced in about 2 weeks. This is a company that started Exponential Medicine in that competition called Scanadu. They basically have a device you hold to your forehead, pulls down your temperature, your heart rate, your O2 sat, calculates that, enables you to triage yourself. They've also developed ways to do smart urinalysis. You can dip your urine at home and have the camera pick up the signal and record your urinalysis and send that data to your doctor, to the CDC, to the NSA, whoever else wants the information. So lots of ways that's coming together. Since I'm out of time, can you just skip to like my fifth to last slide? The ability for all this stuff, I would skip out and go down to like almost the last couple slides. Where this is all heading, I think, is the ability that we can start to donate this data. We can integrate it. We can use artificial intelligence and machine learning to put it together in smart ways and apply to our therapeutics. And I think where this all comes together, keep going, almost the slide with a map. This idea of crowdsourcing, which was just mentioned in Our Crowd. I met the Our Crowd folks in Jerusalem a month ago. Just like, I think 10 years ago, we barely had smartphones. You used to drive with paper maps. Now we couldn't imagine driving without Google Maps or Waze, another great Israeli company. If we go to the slide with Waze on it, please, it's the third, fourth, the last slide. This idea that you can donate your, one back, come on. Keep two more back. There we go. The idea now that we can donate data, our healthcare data, just like you donate your driving data. Here's just a map of Waze. I don't think this is connected, is it? Go back one. Come on. The idea that we can donate data just like we do when we drive. We can build a map of Rome from Waze data. That same kind of mindset could come to health and medicine. Just like we can crowdsource driving, see where the bad traffic jams are for healthcare, we can do that in health and medicine. And if we do that, and we think about not just being organ donors and blood donors, but being data donors, I think we can really catalyze the future of healthcare, which is the convergence of all these technologies. No one technology. It's 3D printing, robotics, and AI and sensors all coming together. And so the takeaway is to think exponentially. Don't think in terms of 2017 with what other kind of startup or investing you're in. Think about where the puck is going to be in just a few years with all these fields. Skate to where the puck is going to be, as Wayne Gretzky says. And if we do that, we can shift from a world of sick care, intermittent and reactive and siloed, to a true area of healthcare, continuous, proactive, and participatory. So I think that's the takeaway, to think exponentially, and so that we all don't just predict the future, we go out there and create it together. So with that, I'll say toda rabah. Thanks. All right.
Nice. Daniel, thank you very much. This brings to the end our session.